Hello, thank you for joining us this evening. Welcome, welcome, welcome. I'm just waiting for my co-host to join. Hey, Soul. Thank you so much. Okay, so my co-host is in here. Let me. Hi, Maya.
What's up?
How are you?
I'm fine, and you?
Happy Wednesday.
Yes.
Women Wednesday, to be exact.
Yes.
Okay, so let
Clear.
me go ahead and plug what I need to plug in,
Uh-huh.
and then we can get started.
Perfect.
But how was your day?
It was busy.
Busy.
Mm.
So I want to give a shout out to Black History. Can you hear me, Maya?
I can hear you now. Yeah, I was like,
Okay.
what happened?
So we're going to shout out Black History Month. February
Absolutely.
is Black History Month. February is not the only time that we are going to celebrate
Yeah.
being Black.
Yes.
You know, this is an ongoing celebration because we have been through so much.
Yes. Especially 2020. Well, no, 2020 was a year for the books.
A year for the books,
Like,
but it has also opened up, a lot of people's eyes. People have found new callings. They have been able to touch bases with their selves, build
yeah,
deeper relationships with people.
absolutely.
Yeah. So that's what sums it up for 2020. How has your 2020 been?
Mm. I think my 2020 was the same as everybody's. It was a mess. A mess. Absolute.
Okay, here I go. Sorry about that. You
I'm like,
know how it is. Oh, let me turn it over a little bit. Okay, now I'm together. You know how it is. But yeah, it's a great time to be alive, to be Black and brown people. As in why I got my shirt on. It
oh, what
says,
is it?
says Black is my happy color.
Period.
Yes. Oh,
Absolutely.
my friend has entered the chat. Hi, friend.
Oof.
Okay, so we could get started. I'm gonna go ahead and jump
Mm-hmm.
right in. During the past few months, Whitman-Walker's Community Health Department has expanded its outreach efforts to social media platform. We cover various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. Our series of outreach sessions also focus on the current pandemic, which is COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support each and every one of you all.
Absolutely. Oh gosh,
So
hold on.
today, we're going to talk about National Black HIV/AIDS Awareness Day, which was this past Sunday. So we wanted to highlight that this month is Black History Month. Not only do we celebrate Black History during February, but for many days coming. It has, again, like we chatted and said, that it has been 2020 has been one for the books, and 2021 started out a little rocky, but we still have more hope, and hopefully with a new president in office, that will bring us some hope. So we want to thank you all for joining us this evening as we have this conversation in commemoration of National Black HIV Awareness Day, which was on this past Sunday, February 7th. So I'm
Yeah.
going to turn the convo over to Maya. So Maya,
Mhm.
do you mind sharing the importance of why we highlight February 7th?
Not at all. So, mind you, this is observed every year on February 7th to highlight the continuing disproportionate impact of HIV on the African American population here in the United States. We want to remind the public of racial disparities that still exist in the United States year after year. And of course, African Americans continue to shoulder, the heaviest burden in the HIV community.
Thank you for sharing, Maya. So, we have 6 things that you need to know about the epidemic's impact on African Americans. The first being Black Americans account for nearly half of all new HIV infections each year. So, despite representing only 13% of the US population. Two is it is estimated that around 14% of Black Americans living with HIV do not know they are infected. Three, 1 in 2 Black gay men nationally will be diagnosed with HIV in their lifetime. Four, HIV rates among Black women in the US have declined. Five, Black transgender women are more likely to have HIV than transgender women of other races and ethnicities. And six, Black Americans are still more likely to die from HIV/AIDS compared to other groups.
Yes.
So, I see that there are people joining into the live. We want to give you all some time to plug in any comments, any questions, or anything that you may have for either one of us, because that was a lot, right?
Yeah, that was a lot to definitely take in.
So, how did you feel about what you just heard, Maya?
I feel like that's definitely something that not per se new to me, but definitely something that I had never really like looked into and heard about for real. So it was definitely good to educate myself, you know, on a topic that is as sensitive as such, especially us being in the positions that we're in here at Whitman-Walker.
Yes. So we highly encourage everyone, whether you work in the sexual health field or not, to get educated and stay up to date with your sexual health as it relates to HIV or any other STIs that
Yeah,
are out. So with that being said,
we
with
do.
that, huh?
Women free HIV and S testing, like you says in the comments.
Yes. Um, so basically what present day has brought, today there are more than 1.1 million people living with HIV/AIDS in the US, and that's including 476,100 people who are Black.
That's a big number.
A
Mm.
very big number.
Yeah. Yeah, so discrimination, stigma, poverty, and lack of access to healthcare all contribute to the disproportionate burden of HIV among Black Americans. This is most notably the case in regions with large Black populations like the American South, where approximately half of the nation's new HIV infections occur, with Black Americans accounting for almost 80% of them. And in general, African Americans are less likely than whites to have private health insurances.
Mm. Okay, so see Rama in the comments. I'm glad to hear that the HIV rates among Black women is decreasing. Yes, I am excited to hear that as well. So that means that we as Black women are educating ourselves and we're going to get tested, or we're finding preventative methods such as PrEP to get on to help us decrease that rate.
Absolutely. Yeah, another
Yeah, the
comment.
numbers are definitely still unsettling.
Still very big numbers.
Mm-hmm. The healthcare system needs to do more to bridge the gap. They definitely do. They definitely do need to do more work and more efforts. And I think it's more so about people not knowing. A lot of people still have a lot of stigma around HIV, and most of the time when you are unsure, what do you do when you're unsure? What do you do when you're unsure about things, Maya?
When I'm unsure, I feel like it depends really on the situation. But first things first, you got to do what you got to do to find out. You got to do what you got to do to
Hmm?
educate you. I'm aware of whatever is presented in front of you, or what could be presented in front of you at all times. And that's definitely why I wanted to highlight, and why we're still highlighting in the comments, that we offer free testing. And you can call and set up an appointment. It was definitely easier when we just did walk-ins, but yes, the testing is there. Like, there's nothing wrong with wanting to know your status and being up to date, especially if you are someone who is sexually active.
Yeah, so the whole goal is when you're unsure about things, the whole goal is for you to um, do your research, get some information that will help support some of the uneasiness that you have about things that are affecting your community. Oftentimes, people hear about things that are going on in the community, but they don't take the precaution or necessary steps to get educated
Right.
um, about those things.
Yes. And there's absolutely nothing wrong with knowing as well. Like, I feel like people shouldn't feel bad for not knowing these numbers or not knowing these statistics and things like that, because it is a lot, especially, and it's a very sensitive topic as well, especially if you know someone who is battling HIV or living with HIV and things of that nature. But it is nothing wrong with becoming educated at any point in
And
time.
it definitely hits different. It definitely hits different in educating yourself and becoming more aware when HIV hits close to home. So when you've experienced a close loved one that is living with HIV and you see the different changes, it makes you sad, but it
Yeah.
also makes you eager to be like, what is going on? And why is it affecting not only my loved one, but somebody else's loved one? And
Right.
why do all the people that it affect look the same?
Right. And that's definitely questions that need to be asked and answered in the medical field. Definitely. Like we said earlier, something needs to be done to bridge this gap.
So I just saw about a minute ago, we from Body Positive Boot Camp asked a question, what was the topic of discussion for this evening? So the topic of discussion is us honoring National Black HIV/AIDS Awareness Day. I didn't want to dismiss your question, and if you haven't already, got a little snippet of what we were talking about. Okay, so there are some prevention challenges as into why some people don't want to get educated or want to even start the process of preventative methods. So there's stigma and fear of discrimination that may prevent African American people with HIV from getting the care that they need or disclosing their status. So if someone has been newly diagnosed with HIV, do you think, Maya, that they will feel open to disclosing that information, um, either to go to a healthcare provider or a close family or friend?
I feel like um the maybe more appropriate thing to do is definitely to seek that help that you need and seek that comfort that you would need, because that is definitely a lot for someone to take in, to have a new diagnosis of that's something that would sit heavy and would of course take a while to digest. I think when you deal with things heavy as such, it is absolutely imperative that you have, that extra care and that extra help
Mhm.
at your disposal.
Okay. So, homophobia can make it difficult for some African American people to be open about risk taking behaviors, which can increase limit social support, and that negatively affects their health. So, these factors may prevent some African American people from accessing HIV prevention and care services.
And I
Um,
understand.
Go ahead.
I feel like I understand that one so much because the LGBTQ community already has all of these hurdles and obstacles and things to overcome, especially in the healthcare field. So when it comes to something as sensitive as HIV, that's definitely, I will understand having to deal with homophobia and things of the such like that. That makes life difficult, period. But with something
Yes.
like this, yeah.
Yes, it
And
definitely
it
does.
sucks. Oh, gee.
It really does. Yeah, you can't hear me?
Oh, it went out for a minute. So I was like, wow, but I can hear you
Okay.
now.
Okay. So, racism, discrimination, and mistrust in the healthcare system may influence whether African American people seek or receive HIV prevention services. So, it goes back to about affordable health care, or like African Americans feeling like, well, if I don't have a certain insurance type of insurance, I can't receive a
Right.
certain level of care. And that should not be the case, because everybody should technically be receiving the same type of quality health care, especially here in the United States. So that is one of the barriers of why some African Americans don't get connected to care. Um, the other one is that lack of awareness of HIV status. So someone not knowing their HIV status can affect the status and the rates in the community. So there's approximately about 1 in 5 adults and adolescents in the U.S. living with HIV that are unaware of their status. So how do you become aware of your status, Maya?
Getting tested. Being
Okay.
involves getting tested regularly.
And
So
that's
you are always up to date at all times, especially when you're sexually active.
mhm. And so, with that statistics, what does that mean? So, that means that there's approximately 116,750 people in the African American community alone that are living with HIV.
And
But yet,
whew,
we have so much stigma around HIV. And so, we have to find the disconnect, and we have to keep doing the work that obviously we're doing, in promoting preventative ways and education, because all it takes is for someone to be educated on topics that they may not feel comfortable about having. And this is where they can always reach out to Women-Walker Health or Real Talk DC, um, to gain more information. So, if you were a young person that just didn't have a clue, what would your suggestion be, Maya?
Well, my suggestion would, for one, be to continuously look out for the lives and things of such that we hold, um, to educate people. Always look out, because you most of the time this is what we do. We educate, we
Mm-hmm.
outreach. I would first, you know, get involved in any of the programs and things that we have. And if there was nothing going on, I wouldn't hesitate to reach out to either pages or to even call our number. There's nothing wrong with calling and asking questions. If you are lost on something and you need guidance and you need answers, you can call, you can ask those questions, and you will receive answers. I will also make it my business to do some of these things on my own, like at home. Just take a minute to research the topic and maybe just read up on it. You never know what you can find on the internet. Like, there is so much to educate us out here. So those are definitely things that I would make sure I would do too.
Okay. Thank you, Maya. So, did
So,
you want? Go ahead. I
yeah,
see
so
we got a lot of little hearts coming.
yeah,
Thank you for the love. Thank you
I
for the love.
Yes, so a late diagnosis of an HIV infection is absolutely common, which creates missed opportunities to obtain early medical and prevention transmission to others. So basically, it is imperative that you try to know, um, as early as possible, basically. The sooner an individual is diagnosed and linked to care, the better the outcome will be for that person.
Thank you, Maya. So I know we've covered a lot, but with the impact of HIV in our Black communities, we want to encourage everyone to learn more about HIV. I mean, everyone. And to continuously educate yourself. So PrEP is a very important HIV preventative tool. If you need more information about PrEP, where can you get that information from? You can call us at 202-939-7690, or you can email us at prepclinic@Whitman-Walker.org for more information.
Yes.
Hi, Lando. Thank you for joining us. Um, do we have any last comments, questions, or concerns?
That was definitely a lot.
That was a lot. It's a lot of information, but the
And
numbers definitely are important, and it's our duty and our role um, to educate our communities.
absolutely.
Maya, I just thought about it. We jumped right into the conversation, and we did not introduce ourselves.
We did not.
Did you? Did you catch that?
I didn't, because I was so focused, like, on everything we had to talk about. I completely forgot that.
So, for you all that still tuned in, our apologies, because this was a very important topic that we wanted to host on both Women Walker platform and Real Talk DC. But I am Chiquita Reed, affectionately known as Chi. Everybody calls me Chi. And I am the youth prevention supervisor for our youth service department. My
Yes.
pronouns are she, her, hers.
Yes. And for those who don't know, my name is Jamyia Kennedy. I am a youth ambassador down in youth services here at Real Talk DC and Whitman-Walker. My pronouns are also she, her, hers.
Okay, so we failed to do that in the beginning, but we always like to save the best for last. So we thank you all for tuning in with us. If you have any questions around sexual health, HIV prevention, or COVID-19, you can call our resource phone line at 202-797-4439. You can also call that same number to schedule a free confidential HIV STI testing appointment. Again, that's 202-797-4439, and it's also pinned in the comment. If you are in need of a COVID-19 test, because COVID is still out and is still real, you can schedule an appointment by emailing appointments at Whitman-Walker.org, or you can call 202-745-7000. Just to keep up to date on COVID-19 vaccine availability in the city and at Whitman-Walker, by visiting our website at www.whitman-walker.org. Or you can always hit the follow button on Whitman-Walker's Instagram page or Facebook and Real Talk DC _. You can also catch us for this same conversation later on tonight. What time is we getting in our bag, Maya?
7:30.
7:30.
7:30.
So to get more information about the bag series, you can join this same platform at 7:15, and you'll get all of that information to tune into our bag series.
7:30. Yes. Be there.
Thank you. Have a good evening, Maya, and I'll see you at 7:15 so we can really get in our bag.
Absolutely. Bye, Chi.
See you.